Hello and welcome back to the channel. As always, I'm your host, Morgan. Full disclosure, this was not the video I was planning to be my first serious video back here, but this piece of environmental news felt too important to put on the back burner. In case you didn't guess by looking at the thumbnail or the title of the video, today we're talking about how the Environmental Protection Agency is proposing to no longer consider the value of human health when making decisions about regulating air pollution. I did already make a short about this a few days ago, but there's more reporting out now on this topic, and I want to sit down and have a more thorough, a little bit more well-rounded conversation about it. I do have my notes here handwritten this time because, like I said, this is not the video that I've been working on to be my first serious video back, but here we are. Before we dive in, I do want to ask that if you find any value here, please go ahead and click the like button. If you want to see more of me and my content recommended to you, click the subscribe button and consider flirting with that little bell icon so you get notifications about when I do post videos in the future. Also, if you want to contribute to the conversation, and I do really love seeing thoughtful interactions down in the comment section below, put those thoughts down in that comment section below. I do really like reading them and I do like interacting because there have been some pretty good conversations happening under some of my videos. But without further ado, let's go ahead and get into this topic. Earlier this week, the story was originally broken by the New York Times, as they were the publication that obtained and reviewed some interagency emails that outlined this proposal for the EPA to stop calculating the monetary value of public health when making air pollution regulation decisions. My initial question when I was first reading about this news was, how is that monetary value actually calculated? Because that seems kind of difficult. How do you put a dollar amount on human health? Well, the Associated Press article that I'm referring to today does spell it out, and it does make sense now that I've read it. How they make this value or calculate this value is they look at the money that is saved in healthcare costs and the deaths that are prevented by the air pollution rules specifically. So what's going to happen now is the EPA, or at least what they're proposing, is to no longer do that. Instead, the EPA is only going to look at the costs to industry to better align with Donald Trump's, quote, business-friendly approach to regulation. And this business-friendly approach includes things like rollbacks of policies that were originally put into place to, safeguard human health and address climate change, which climate change is already a hot button topic because Donald Trump and a large part of his administration are, if not full on climate change deniers, climate change skeptics. But that's a conversation for another video. So let's move on here. At this point, I think it's important for us to pause and take a look at the EPA's mission statement, specifically bullet point number 3. The EPA works to ensure that federal laws protecting human health and the environment are administered and enforced fairly, effectively, and as Congress intended. Now, according to a statement released on January 12th, 2026, the EPA claims to be upholding this mission, but critics disagree. I can include myself in the list of critics that do disagree, as well as representatives from the NRDC and other entities like that. What critics are claiming is that Trump's EPA is refusing to put any value on protecting the health of the people that the agency is meant to protect by potentially adopting these changes. Through a spokesperson, Bridget Hirsch, the EPA did push back on this claim by saying, quote, "Not monetizing does not equal not considering or not valuing the human health impact." My question here, however, is if you're not using this very real monetary value of human health in your considerations for air pollution rules, then how exactly are you considering the impacts to human health? Because the monetary value is actually a very decent piece of quantitative data. And when you're making decisions, you need data like that. So if you're no longer going to consider that, exactly how are you going to take human health into account when addressing air pollution? This is my big question, and the thing that to me says that the EPA is obviously moving away from its core mission statement and the obligations of the agency. Air pollution and human health should be something that is a big concern for the EPA, especially right now, as a recent study showed that US carbon pollution in 2025 was 2.4% higher than it was in 2024. Now, there were multiple reasons that were given for this rise, and it was noted that it is currently too early to see how these Trump era rollbacks and things are going to impact this. But experts in these fields are saying that this is alarming to see, and I have to agree, quite frankly. What I suspect and I fear is that as these rollbacks continue, we are going to see not only an increase in pollution, but an increase in asthma attacks, preventable deaths, and everything else that goes along with people living with very polluted air and more or less unregulated industry. If you're sitting there feeling a little helpless at this point, I do want to try to give you a little bit of a call to action. And I know this one might be kind of frustrating because there's a lot of us advocates out here saying to do what I'm about to tell you. I want you to call your representatives, and not just call, but email, send snail mail, whatever you can do to get in touch with them. Let them know how this potential change in the EPA is concerning you. Let them know that as a constituent, if they are not vocal about their disagreement with the EPA no longer valuing human health in their considerations for air pollution rules, they may lose their seat in the midterms if they're running for re-election or are up for re-election. Because this is one of the greatest powers that we as citizens have, is getting in touch with and bugging our representatives. We have already done good things for public lands in the very least by reaching out to our representatives. We have gotten measures removed from bills that would have mandated sales of public lands by our public outcry. We may not feel like we have power because we feel like little small fish in a big sea, but calling and bugging our representatives and reminding them that they work for us and our health matters to us can potentially prevent dangerous things like this EPA proposal. So do not be afraid to pick up the phone. I know it's frustrating to hear that again and again, but it does work. That's all I have for you today. This was kind of a shorter one considering some of the videos I have put out in the past, but I feel like this was a very important topic. So if you have any thoughts here, please put them down in that comment section below. If you got anything out of this video, give it a like. If you want to see more of me and my content coming at you, go ahead and click that subscribe button and consider flirting with that bell so you get notifications. And if you are someone who has watched my videos in the past, how do you feel about this more casual kind of filming setup? I don't know how I feel about it personally, but if you have feedback, I'd love to get that feedback. But So I don't just sit here and ramble at you, I'm gonna go ahead and wish that you have a wonderful rest of your day, afternoon, evening, what have you, and I will see you all in the next one.